Good morning, and thank you for joining our Facebook Live event today. My name is Jessica Steger, and I'm the Executive Director of Clinic Operations for UnityPoint Health Dubuque. Today and over the next several minutes, we will be highlighting our UnityPoint Health Clinic Women's Health, and with me I have Gretchen Hong. She is one of our nurse practitioners at the clinic. Just a brief overview of our clinic. Our clinic opened August 2016, so we've been in practice for almost about a year now. The clinic is open Monday through Friday, 8 a.m. to 5 p.m. when we are closed over the lunch hour. We do have two providers. Again, Gretchen is one of our nurse practitioners, and Brenda Huseman is another nurse practitioner that practices out of this location. Right now I'm going to take some time to introduce Gretchen and let her talk a little bit about her background and her passion for women's health, and then we'll highlight the services at this clinic after a bit. So Gretchen, why don't you tell us a little bit about yourself and your background?
Well, my name is Gretchen Hong, and I'm a nurse practitioner. I do adult care and I do women's health care, so I have both of those specialties. I've been in practice for about 8 years now. I practiced in various places in the country. I'm originally from Dubuque, so of course I couldn't stay away for very long, so I'm back home, which is lovely. And I started practice out in New York City in Manhattan. Worked there in a primary care center doing prenatal care and adult care and GYN care for about 2 years before I moved from there. And I moved to Harrisburg, Pennsylvania, and was practicing there for a while, doing mainly GYN, and then came here about 2 years ago and started practice here. And I'm loving what I do. I really am very passionate about what I do for the patients that we have here.
Gretchen, can you tell me a little bit on why you wanted your focus to go into women's health? What drew you to the women's health focus?
Well, honestly, I'm very passionate about providing care for women, and in general, I feel that women we have a hard life as is. We have a lot of responsibilities. We have a lot of things that we need to do. If we can have all the convenience of our health care in one place, that's just the best care that we can provide for a woman. And for me, it was frustrating going through school, and I was learning about, actually as I was practicing through clinicals, it's where I noticed that women were telling me that they were going to their GYN for their primary care, and that they were kind of missing out on preventative care practices because of it. So they were going to multiple providers, and who has time for that?
Right.
So they would have like 2 annual exams a year. They'd go to their annual adult provider, and then they would go for their annual to GYN. And I thought, well, I could just merge that together and provide a better, a more comprehensive package for a patient, take care of her for her GYN needs as well as for her adult primary care needs, with her immunizations, with her chronic medical conditions, for like whatever flares up in the meantime, if it were a rash or a sinus infection or whatever, or manage her hypertension or diabetes. And I felt that would be almost like creating a medical home for her, that this would be basically a home base that she could come to and get whatever care she needed. And that's kind of where I started my practice.
That's great, Gretchen. That's why we have such a wonderful provider at our location. So just to highlight some of the services that we do here. So when we say it's a women's health clinic, it's really a primary care clinic for women. We service adolescents all the way through the elderly population. We want to provide care for various stages of life, and it's both primary and acute care services. And it's really a place we want women to come and feel comfortable as well as confident in their health care. And it's that personalized, comprehensive health care that's just very tailored for women and focused upon women. So Gretchen, why don't you tell us a little bit about, on a day-to-day basis, what are some primary care services that you see and do in the clinic that if I were to call and make an appointment, what are some things that I would be expected to be seen for?
So, you mean like what are the main presentations?
What are some of the things that I could come here and get treated for or be seen for?
Absolutely, an annual preventative visit. I very strongly feel that preventative medicine is the place to be. If you can prevent something from happening or catch it early enough, the outcome is so much better. So preventative services where you have an annual exam or annual physical screening tests, mammograms, or screening for diabetes or high cholesterol. That sort of process would be usually an annual exam. Management of chronic conditions such as like diabetes, hypertension, thyroid problems, pretty much you name it, we're managing it. Then there's like acute illnesses, people coming in with, rashes, bites, or sinus issues, pink eye, cough, pretty much everything under the sun I've seen.
So it's really a one-stop shop for women, whether it's managing your chronic conditions as well as you had a cough, cold, you can call and be seen that day as well from one of the providers here.
It's also nice that, we as providers, we know our patients, we know them, and they feel comfortable here that they can come in here, do their annuals, but they can also come in and be seen and know the provider that they're already seeing, who knows their whole history and can manage them for all their conditions. Another one too is another common one is depression and anxiety. They feel like a lot of people are not really comfortable to discuss, it with just any old provider. So if you just, having that comfortable conversation, feeling welcomed and that not judged for where you are, and being able to just take care of you from where you are and help you to have a better quality of life. And that's what we're about.
Absolutely. And speaking on with the depression or the counseling aspect as well, we've partnered with Hillcrest recently, Hillcrest Family Services, and we do offer counseling services out of our primary care locations, and one of the locations being our women's health location. So we do have a counselor that is on site 1 to 2 days a week, and if your provider does feel that you would benefit from counseling, we have that on site and it's offered here. You can come to the clinic that you're comfortable in, and you can be seen for that as well. Gretchen, do you want to go into some of the gynecological services that are offered at the clinic here?
Well, sure, absolutely. So most of that would be, we have, the annual GYN exams that you would do normally. We would do pap smear, cervical cancer screenings, clinical breast exams for, evaluation to make sure there's not risk for breast cancer. We refer out for mammograms. We don't do mammograms here, but we do send out for those. We do follow-up for abnormal pap smears, so I do colposcopy as well. I do IUD insertions. We do birth control maintenance for all forms of birth control. So that's usually what I think of when I think of for women's health.
Irregular periods,
osteoporosis,
osteoporosis,
sure.
hormone replacement.
Oh, I didn't even think about that. Yeah, absolutely. We do all that too. Yeah, absolutely. Menopause is another really common one, that transition, the perimenopause between where,
We do offer a wide variety of services, and again, we have a great group of providers that are willing to take care of all your healthcare needs as well as the staff at the clinic. We have radiology on site as well. So you come in, you think you have a cold cough, you may need a chest x-ray, or you have a broken arm, or anything that would indicate any type of a broken bone. We do have that service right here at the clinic, so we do not need to send you off campus for that. We do offer lab services here as well, and any labs, we can just courier them off site. But everything is so close and convenient, and we have some great staff and providers for you to be seen here at our Women's Health Clinic. Well, thank you very much, Gretchen. It was very nice talking with you today. And I thank you for joining our Facebook Live event. If you have any more questions or you want to learn more about our clinic, you can visit www.unitypoint.org. And again, thank you for joining us today.